there is something many men never expect to happen as they get older. One day, they begin noticing small changes. Nothing dramatic, nothing painful, just little things that seem easy to ignore. Maybe they start waking up once during the night to use the bathroom, then twice, then 3 times. Maybe the urine stream does not feel as strong as it used to. Maybe it takes a little longer to start urinating. Maybe there is a feeling that the bladder never completely empties. And because these changes happen gradually, most men assume they are simply part of getting older. But sometimes, these symptoms are signs that the prostate is getting larger. My name is Dr. Michael Reed. Welcome to Health Lab. Today we are going to talk about 7 warning signs that your prostate may be enlarging. We will discuss why these symptoms happen, when they should concern you, and what steps you can take to protect your long-term health. And make sure you stay until the end because I will also explain one symptom that many men completely ignore, even though it can have a major impact on their quality of life. If you enjoy videos that help you stay informed and healthy, please take a moment to like this video, subscribe to the channel, and leave a comment below telling us your age and where you are watching from. Now let's begin. First, let's quickly understand what the prostate actually is. The prostate is a small gland found only in men. It sits just below the bladder and surrounds part of the urethra, the tube that carries urine out of the body. When men are younger, the prostate is usually about the size of a walnut. But as men age, it often begins to grow. This condition is called benign prostatic hyperplasia, or BPH. The word benign means it is not cancer. However, even though it is not cancerous, it can still cause significant symptoms. As the prostate enlarges, it begins pressing against the urethra. This makes it harder for urine to flow normally, and that is where many of the symptoms begin. Let's talk about the first warning sign. Number 1. Frequent urination. This is often one of the earliest signs. You may notice that you need to use the bathroom more often than before. You may find yourself planning activities around restroom locations. Long car rides become inconvenient. Movies become difficult to sit through. Meetings feel uncomfortable. The reason this happens is that the bladder has to work harder when the prostate presses against the urinary pathway. Over time, the bladder becomes more sensitive and starts sending signals even when it is not completely full. Many men dismiss this symptom, but if you find yourself urinating much more frequently than before, it may be worth paying attention. Now let's move to warning sign number 2. Waking up multiple times during the night to urinate. This symptom is extremely common. Many men think it is just part of aging, and while age certainly plays a role, waking up repeatedly during the night is not something you should automatically ignore. Imagine going to bed at 10 o'clock. You wake up at midnight, then again at 2, then again at 4, night after night. Over time, this can severely affect sleep quality. Poor sleep can impact energy levels, mood, memory, concentration, and even heart health. Many men seek help for fatigue without realizing that prostate-related nighttime urination may be contributing to the problem. Now, let's discuss warning sign number 3. A weak urine stream. This is one of the most classic symptoms of an enlarging prostate. The stream may not travel as far as it once did. It may feel slower, weaker, less forceful. Many men notice this change but rarely talk about it. The prostate gradually narrows the urinary passage. As a result, urine cannot flow as freely. Because the change happens slowly, it is often overlooked. But if your urine stream is significantly weaker than it used to be, your prostate may be involved. Now let's move to warning sign number 4. Difficulty starting urination. Some men describe standing at the toilet and waiting. And waiting. And waiting. The urge to urinate is there. But the flow does not begin immediately. This hesitation can become frustrating, and in some cases it becomes worse over time. Again, this happens because the enlarged prostate interferes with the normal flow of urine. The bladder is ready, but the pathway is partially restricted. Many men assume this is normal aging. It is common. But common does not mean normal, and it should not be ignored. Now let's discuss warning sign number 5, the feeling that the bladder never completely empties. This symptom can be surprisingly uncomfortable. You finish urinating, you wash your hands, you leave the bathroom, and a few minutes later it feels like you need to go again. Many men describe a persistent sensation that there is still urine remaining in the bladder. This happens because the obstruction created by the prostate can prevent complete emptying. When urine remains trapped inside the bladder, it can also increase the risk of urinary tract infections and other complications. Now let's move to warning sign number 6, sudden urgency. This symptom can catch men off guard. You feel fine. Then suddenly you need a bathroom immediately. Not in 10 minutes, not in 5 minutes. Right now. This happens because the bladder becomes increasingly sensitive over time. The signals become stronger and more urgent. Some men become anxious about leaving home because they worry about restroom access. This can have a major impact on quality of life. And unfortunately, many men suffer in silence because they are embarrassed to discuss it. Now let's talk about warning sign number 7, dribbling after urination. Many men notice that even after they finish urinating, small amounts of urine continue to leak. This can be frustrating and inconvenient. Some men begin carrying extra clothing, others become self-conscious. This symptom occurs because urine may remain trapped in the urethra after the bladder empties. As prostate enlargement progresses, dribbling often becomes more noticeable. And this brings us to something important. Having one of these symptoms does not automatically mean you have a serious problem. However, if you are experiencing several of these signs together, it may be time to speak with a healthcare professional. Now, I want to clear up a common misconception. Many men immediately worry about prostate cancer when they hear about prostate enlargement. But benign prostate enlargement and prostate cancer are not the same thing. The symptoms can sometimes overlap. That is why proper medical evaluation is important. A doctor can help determine what is actually causing your symptoms. Now let's talk briefly about risk factors. Why does the prostate enlarge? The biggest factor is age. The condition becomes increasingly common after 50. Hormonal changes also play a role. Family history may increase risk. Excess body weight may contribute as well. And while prostate enlargement cannot always be prevented, healthy lifestyle habits may help support urinary and prostate health. Regular exercise, maintaining a healthy weight, managing blood sugar, eating a balanced diet, staying hydrated, and avoiding excessive alcohol consumption. These habits support overall health and may help reduce symptom severity. Now there's something else many men need to hear. Do not wait until symptoms become severe before seeking help. One of the biggest mistakes I see is men waiting years before mentioning urinary problems to their doctor. By that point, the symptoms may be significantly affecting sleep, energy levels, and quality of life. The earlier you address the issue, the more treatment options are usually available. And modern treatments have improved dramatically over the years. Many men are surprised to learn that help is available. Now, before we finish, I want you to remember these 7 warning signs. Frequent urination, waking up multiple times during the night, a weak urine stream, difficulty starting urination, the feeling that the bladder never empties completely, sudden urgency, and dribbling after urination. If several of these sound familiar, do not ignore them. Your body is often giving you important information. The sooner you listen, the better. And if you found this video helpful, please support the channel by giving this video a like, subscribing to Health Lab, and turning on notifications so you never miss future health videos. Also, leave a comment below and tell me which of these symptoms surprised you the most. My name is Dr. Michael Reed. Thank you for spending this time with me. Take care of your health, take care of your future, and I will see you in the next video.